Hello, hello everyone. It's another week now. We start again. Tonight is the medical night. Now tonight is has been a very. It's been a quite a while. I want to put this this lecture out. Tim, take a picture, please, and you know exactly where we are talking about when the camera moves away. Okay, yeah. 4 parts. All right, can you start? I'm start with all the pictures. Thank you. Okay, now I'm teaching all these physiotherapists now. This is in the University College of Banska Bystrica, all right, yeah, in Slovakia. Okay, yeah, because it's very, very important that because we nailed down internal Taoist medicine study and we are not using any herbs. So the question you should be asking the teachers or the guy who's standing in front of you, how can we use this kind of manipulations of musculoskeletal, systems, massage, you call it, all right, yeah, can trigger the natural body medicine come out for self-healing? Is it not the topic, the major we're talking about? Okay, so this is why this is a very important major study in, our particular Taoist medicine, the internal. Now, this is another group, different places. Okay, yeah, more university. Also, you can see me, I'm using this, you call massage, right? We call it on cue, right? Yeah. And actually, you can see now this coma patient's been a year, okay? And I'm working in a hospital. Now, you can see me, I'm massaging it, but when I do my massage, I actually emit energy. That's why the major is emission of energy. Okay, so this lesson is only a part of a big, a big lectures I prepare for you guys. Okay, so we've only got an hour. See how much we can cover. And I actually brought this coma patient back, right? To obviously a waking up. And how? Why can I do it? Okay, now you can see now the point. There is 2 points that I'm using. The major point, in the middle, that is a very important point, right? We call it yamen, dumbness. You cannot talk, right? Just translation, yamen, amun. Very, very important thing, right? Don't play with this one. You kill people with that one. So again, it is very, very dangerous if you play with medicine. The medical practices you don't even know anything about. Okay, yeah. This is University College of Nursing. Okay, again, I'm teaching, all the physiotherapists. Okay, yeah, and other doctors as well. Okay, now I'm quoting back to the background and history now. Okay, so like I said, I don't make things up. I'm not that clever. I have to study. I've been studying all my life and I'm still studying and I'm still practicing. Okay, so nobody found anything. So anybody tell you to found this and found that and creating this, creating that, then you should ask them, have you been studying? Huh? So if anybody has to study, how can you find something? You cannot find it because knowledge is passing down, it's accumulations of experiences. How can somebody just go to bed and wake up and say, oh, I found this style of thing, I found this style of things? No, you cannot find it. Okay, you have to learn it. You cannot have to learn it and then, you have to use it. So be careful with these people. Right, okay, yeah. If anybody said he found this and found that, you should put a question mark over it and ask him his training background. Okay, now, these are very, very old texts and part of when I'm doing my dissertation 17 years ago in the library in the Shandong University and other university. I've been spending 17 years trying to, obviously check out all these, because I cannot find anything. I have to have something to be using as a references. So I quickly just put out a few, right? Yeah, so I'm using here. I'll just translate because it's all in Chinese. So we've got a few minutes. So the earliest, I would say here, the earliest record in China. Okay, firstly, I'll say it here. It is this kind of massage thing of physiotherapists, whatever you call it, it's just a name. It's just a name. So don't argue about the name, okay? It's actually a natural phenomenon of human being. So for example, you bump into something, you walk carelessly and you bump into something and it will touch your hand will actually naturally, right, subconsciously will start touching it and start massaging it yourself, isn't it? Oh, yeah, let's get better. Oh, that's nice. So is it not a natural phenomenon? Okay, so actually everything is natural. That's why internal Naidan, Taoist medicine, is a natural self-healing phenomenon. So over a thousand years, the ancient Chinese put together all the experience and formulate this type of studying. Okay, so the earliest records here is the end of Zhou Dynasty. Okay, and there's a text there, and Zhou Dynasty around about 3,000 years ago. Okay, and then the second one now I'm pulling out from all these old texts. Okay, yeah, so you can look at the old text and I'm pulling out for you. And also the other one, earliest one would be spring, autumn, and spring and autumn warring state, that around about 2,800 years ago. And in one of the texts, okay, it recorded one of these, well, that time already people called it the Taoist medicine, okay? But Taoist, don't forget, Taoist medicine prior to that, is also another name called Yi, the medicine of the Yi, study of changes of medicine. So don't worry about all these names of it. I'll just try to quote you at the moment, okay? And this Binja in Cantonese, is a very well-known external and internal Taoist medical professional. And he actually, one time is recording here, say, he worked for the palace, and one of the prince, right, just have, I think it's a secret in the old text called secret, right? Yeah. But when I check, it's just like suddenly it could be a stroke, it could be, a sudden failure, it could be a cardio arrest. And then what he did was he was using manipulation of the energy point. So it's clearly marked down here. That was 2,800 years ago. And then in the Chun Dynasty and Han Dynasty, that's around about 2002. There is also now the emperor, the canons. Okay, the canon. They treat it like the Bible of this medical, in China, isn't it? Medicine. And it was saying on the 10th scroll, because the old texts come in scrolls, bamboo strokes, all the bamboo rolling around and on more king. And the earliest record of another Taoist medicine doctors or physicians, Zhang Zhongging in Chinese, Zhang Zhongging, and he was recording that he was using some form of this, we call on-cue, right? The pressurizing techniques to reactivate somebody who that's obviously according to it is a cardio attack. Now, if that like on is, you say it here is on ngak in the Chinese written on ngak on cue. Okay. Now that means that hands on, press with the hand. So press, and somebody would just, having, shall we say, just collapse. So would you say that today, what do you call? CPR. Okay. So this is very interesting. 2,200 years old, this technique is already used, CPR, for emergency resuscitations. Okay, so I didn't make it up. Okay, it's all in all this old text recording here. Okay, and then the Jun Dynasty, around 1,700 years ago, Gok Hong, another Taoist doctors and Taoist physicians. Zhang Hou Bei Gub form, he's very, very well known, right? He wrote a lot of these old texts, okay? And he was it was recording that he was using techniques of toe. So when you do the Chinese call toe is actually cow in Cantonese, cow. That means you're using the finger techniques to manipulate like this, to dig it in and cow. And he was using very successful on people, again, people just passed out. He was using the kind of techniques. Okay, yeah. Now I'm sure Paul, you learned it, haven't you? Here, Renjong.
Yes.
Okay.
Yes, I've used it.
Yeah. Now that's very effective, very, very effective. So anybody passed out, use it here. But obviously you have to know what to do first. Okay, yeah. So I can't really teach you over 1 hour. Okay, yeah. So that technique has been recorded 1,700 years ago. Cui Tong Qiu Tang Dynasty around 1,500 and previous Cui Qiu 1,700 years. It was recording that in the palace they already have the palace or the health administrator then. Okay, yeah, okay, for the emperor at that time, because we called it the emperor and the empresses, isn't it? And they have about 12 specialized, okay, Taoist, internal Taoist, the therapy, we call it, on-cue therapists. They take turns to serve the emperor and obviously, all the ruling class. And also in Song Dynasty, around 1,000 years, and there was this Taoist medicine, doctors and physicians called Long On. And the record here is that one of his patients is a pregnant woman, and they found it difficult for the birth. And he was using this manipulating now. Manipulate TuiNa. Tui is pushing, La is, obviously coming to different methods of how you manipulate the musculoskeletal things. There are many, many techniques. And it was recorded here. He was helping the pregnant woman to give birth, right? A difficult birth. Okay. So next picture, please. Quickly, we finish it. Okay, now myself been practicing 28 years now. So obviously, like I said, the most important thing for us as a Taoist medicine manipulating is the heavenly pillar, the semi-spinalis erector, because you've got a lot of energy point going through, and that also housing, the 36 the vertebrae is bone. They, obviously they cannot move. And inside is the spinal cord, 31 pair of spinal nerves. And it's this huge ligaments, which we call heavenly pillar, which is today, you can check it on, is semi-spinalis erector. And that column of muscle and ligaments, that's the one we can manipulating, right? With these TuiNa or massage techniques. Okay, so there's some tip for you. Okay, yeah. Again, next picture. And also the technique Bu Qi. That means before you start, if your energy level is powerful enough, you should put a shield over the patients. That means you actually make connection with the patients. And when you make connection with the patients, then it's a lot easier for you to emit the energy inside to the patient to help with when you're on the surface externally, you are doing right all the good work, and internally the energy go inside, and also they're doing work inside the body. So you have the yin and the yang, and that will give you very, very successful obviously the results. Okay, yeah. Energizing, obviously, if you have to know a lot more on the energizing what point, and so that's why second part I will explain a bit more on how we energize people. Okay, now this is obviously today's, I'll just stick something out, the on cue in the Chinese character. On is press or finger work, so we say, so we work on finger work. And then cue actually is footwork. Right now, so I don't think many of you don't understand or never experienced using foot for massage. Now, if you look at this picture, look it up right on the ceiling. See that? That's 2 handlebar. Very, very specialized, very skillful therapist using this, because the back, like myself, in Hong Kong every week, right? I will go to, the specialized clinics, because sometimes a lot of things I cannot help myself. I can't reach it, and all those years of training, my intercostal muscle is so thick. I need somebody to work for me. Okay, cleansing. That special, very special clinic I use, they all run by blind people. Blind people. That's something that you don't know. Blind people, I'm telling you, I've studied with many, many blind teachers, and their sensitivity, because they cannot see, they sense it. They were superior, I'm telling you. They just put their hands over it and bang, when they were doing it, right on the spot. Yeah. So egg research in the future, I will organize some classes for blind people. I will train them a lot more blind people. Firstly, obviously there's speciality, because, they lost the vision, the body is an amazing machine. They lost it in something else, we replace it. And that's the sensitive to the skin. And also we can create a lot of job for them as well. So hopefully in the future, the egg research can do that. Okay. And when they go out, to help other people. So we're all happy. Everybody's happy. Next picture. Okay, now this is how you're doing it. They're very skillful, because the body weight is going to crush down on your spine. If you don't know it, you do more damages, right, than try to help people. So don't play with things you don't know. Okay, next picture, please. Okay, now that is the Chinese character. Good. Mark it now, please. Okay, so prepare for